and 16 edited books and 22 patents. He has delivered numerous keynote speeches, organized, chaired international conferences, and consulted countless public and private business intelligence, machine learning, data science, deep learning, and cloud computing, mobile computing, then IoT, information systems, management, science, and other their applications, mainly in healthcare and medical domains. He participated in many EU and locally funded projects, including a 1 million euro Erasmus capacity building project in education, titled Training for Medical Education via Medical Research, Medical Education via Innovative E-Technology, Meditech, and the Malta Council of Science and Technologies Space Research Funds. The University of Malta has awarded him the 2021 to 2022 Research Excellence Award for exploring novel intelligent computing methods for healthcare requirements forecasting, allocation management, and SEE healthcare. So, in among us, we have such an eminent keynote speaker, Professor Lalit Garg, sir. Let us welcome with a big round of applause. Over to you, sir.
Thank you very much indeed, Bosubabu, for such a nice introduction.
Yes, sir.
So let me try to present my slides. Okay, so
yes, sir.
let me
Please share it,
see.
sir.
Yes. No. Okay, so I hope you are able to see my slides. Are you able to see my slides?
No, sir.
Please. No?
Just a moment. Just a moment. Just a moment, sir. Yes, we can able to see your slides, sir.
Okay, good. You can see. Good. So this is, well, Malta, where I'm presently situated, and I'm citizen of Malta. So that's my nation. Okay, and today's topic is health intelligence through satellite data analytics and digital twin. So, well, I'm an associate professor, as a professor have already introduced. Okay, so Malta is almost 7,000 kilometers far from your institute where this conference is being organized, Lendi, Institute of Engineering and Technology. Okay. So, well, we are at two completely different universe. You can see Malta is among the tiniest country in the world, or third smallest country in the world. Okay, after Monaco and Vatican City. Okay, so you can see India is almost 3,000 times than Malta. Even in terms of population, in terms of area, well, India is 10,000 times than Malta. One thing is, life expectancy is among the highest in the world and highest in Europe, which is 82.75 years in Malta, which is almost 13 years higher than India. And Human Development Index is also quite high. And yes, unemployment rate is among the lowest in the world. In fact, lowest in European Union and second lowest in the world after Qatar. Okay. Our GDP is being a tiny country, quite small, but per capita GDP is almost 15 times than India. Okay. In nominal case, okay, while in case of PPP, it's almost 8 times, 7 to 8 times. Okay, so the difference is, well, because of that, Malta is a world capital for internet games. So 60% of all internet games are licensed by Malta. It's also headquarter of blockchain, DLT, and cryptocurrency. So like Binance and all these, if you are dealing with cryptocurrency, or all the blockchain development being centered in Malta. Well, Malta is the first country in the world which recognized blockchain in its regulation. Okay. It is also a hub for offshore banking, so sometimes it's considered as tax haven, but after global minimum tax, that status might not continue, but still we are very much advanced in offshore banking or fintech, financial technologies, and for favorite location for shooting movies. Okay, show like old movies, Charas and was filmed here, Great Gambler, but latest Thugs of Hindustan, Bharat, or Bollywood movie, or yeah, Game of Thrones. There are many, many more movies, okay, being filmed here. Okay, so recently Napoleon. Okay, so to understand this topic, first we have to understand what a complex system is, or even before what a system is. Okay. So I would like to ask a question. What is most important, most essential in your life? Well, some might say health, some might say family, some might say career, some might say power, money. Okay. But the fact is, the most essential for everyone's life is the life itself. Without life, nothing is important. Although we don't give much attention to this fact, so it is important to give ample attention to this fact. What that means? Means your first most essential goal is to have survival or longevity. Survival or longevity means predicting future so that if there is a threat, you can avoid these threats or you can prepare yourself to deal with these threats. Okay. How to predict? Well, for that, you need knowledge or understanding of the complex system or events, activities happening in the world so that you can find out the interaction and predict them. So it's a complex system. So before that, we have to define the system where two or more entities are interacting with each other and the state will depend on that interaction and their present state. Okay, so you should know about the present state and the interaction. Okay, so like Turing machine, which is okay, finite number of states, okay, finite number of inputs and finite number of outputs and finite number of interactions. When there are large number of such entities, so large number of such interactions, it becomes too complex to understand these interactions. If we find it too complex to understand these interactions, it's difficult to predict the state of the system, even the present state as well as future state. So it becomes so complex. Okay, we came with some alternatives. Okay, which is okay, obviously artificial intelligence, which is giving heuristic or rule of thumb. Okay, where you are even without understanding all the interactions, you try to predict the future states. Okay, so human, how do you do that? Okay, first we use our senses. So we have five senses as well as libraries or books or asking others, okay, to collect knowledge. Sometimes that knowledge might be incorrect, okay, when there is no synchronous synergy between various senses, it might be incorrect. Okay, then we process that knowledge. Okay, once we have knowledge about okay all the entities and their interaction, and then based on that we try to process that information or knowledge to predict the future events, okay, which might be biased because we have a limited capacity of processing that knowledge. We have one brain obviously, and then to judge if the knowledge collected is correct or incorrect, we try to take actions or decisions based on knowledge we have collected and processed. So you can see in your lifetime, you can take limited number of decisions or actions. Okay, so you can only analyze limited number of knowledge collected. Okay, so less feedback, less learning. To deal with this situation, we developed machines. Okay, so through sensors, we can collect infinite knowledge, obviously. Okay, unlimited knowledge. It might be automated, and we can ensure the knowledge collected is correct. Okay, we can include redundancy. So instead of using one sensor for the same, we can use multiple sensors, and they are analyzing each other's knowledge correctness. Okay, you know, in network system also we can correct the information. Okay, so while transferring that knowledge, okay, then processing, depending on the requirement, we can have almost unlimited number of processing units. Okay, so unlimited capacity. We can also ensure that this is unbiased processing. Okay, and then we can simulate that, and based on that we can take decisions or actions. Okay, even in simulation, not in real life. Okay, and if they are giving desired results, we can confirm the knowledge process is correct, unbiased. If they are giving unexpected results, we can use a reinforcement to ensure, okay, or to correct the knowledge collected or processed. Okay, so this is called extended intelligence because we are using it in addition to human intelligence. So, why we predict? To control future events or to prepare ourselves to deal with these future events. Well, this thing was well understood like 5,000 years back in holy book Srimad Bhagavad Gita. They have written Karmandeva Adhikaraste Ma Phaleshu Kadachan, which is actually indicating that we have a very complex system. So understanding that system is extremely challenging. And because of that, it's challenging to predict its future states. And if it is challenging and we are having limited knowledge, okay, so we can't control with our deeds. Okay, so Ma karfal hetu purva shango asti karmani means we can do our deeds, okay, but we cannot expect that all our deeds will give us desired outcome. That was the starting of a new era where the human quest was to collect as much knowledge as they can, okay, in form of books and other forms, okay, and then after collecting, process as much as knowledge so that you can understand the system, and then you can better predict the outcome or better connect your deeds with expected outcome. Okay, so in that quest, everyone started. Okay, now as we have already seen, single human has a limited capacity. So a new era was also promoting writing of that knowledge so that we can share that knowledge. So sharing of that knowledge started from that. Okay, which helped. Okay, if the knowledge is being shared, then you can get lot much knowledge. Okay, and you can improve your predictions and control on the processes. Okay, there was one more obstacle in that, which is our perception. Perception might be different than reality. What is perception? Perception comes from your experience. Okay, and also because of less knowledge of the system. This complexity of the system also force us to follow our perception reality, because many times reality is not understood well. Okay, so for example, there are two roads. Okay, one is very safe. Okay, so probability of accident is 1 in 100,000, while another road is having is accident prone, so the probability of accidents is 1 in 100. Okay, you have been to the road which is having a very high probability of accidents. You went there 2-3 times, you didn't see any accident, you were lucky enough. While you went to other road, which is very safe, but unfortunately you saw an accident. Now your perception will tell that accident prone road is safe, while the safe road is accident prone. Okay, so you will always take that accident prone road, and you might come across accident quite frequently later. So you can see your decision was wrong based on your perception because reality was different. Okay? So that was well understood in the first artificial intelligence algorithm, which is called hill climbing. Okay? Those who are finding it like why I'm discussing all these, because I'm creating the background for the more complex topic. Okay. So what is hill climbing algorithm? You are in a terrain where there are multiple hills. Okay. If you are at the beginning of that terrain, you can only see local maxima. You can't see global maxima because of the angle. Okay. So if as a human, you have 5 senses, and these 5 senses will tell you local maxima is the global maxima if there is no other knowledge shared by others. Okay. So if you want to be at the top of the world, you will take decision based on this local maxima. Okay. But if you travel to local maxima slowly, soon you will start seeing global maxima. That will be a big surprise for you. So the impact of that is you will lose confidence in your decision making, in your knowledge. Okay. So in next time, you will take only short-term decisions. Okay. So you might say, I don't know what might be next after local maxima. Okay. Many times you will avoid taking decisions. You might say, my decisions are wrong because my knowledge was limited. So why should I take decisions? And that might create problems. Okay. So the solution of this problem might have been knowledge sharing again. If someone else has been here, then you can share that knowledge with him, and then you might know that there is also a global maximum. Another option is when you start, you might start perceiving that yes, whatever you are seeing, there might be something else as well. You have limited capacity, so you will always keep a possibility of an error. Okay, so whenever you take a decision, you will consider there might be some error. Okay, so by analyzing this, we realize that this is the phenomena which decides if a country will be developed, developing, or undeveloped. You might be surprised. How is that? How only this algorithm can decide that? So let me explain you once again. Okay, so if there is huge uncertainty, okay, means you cannot predict for long term. Like here, you can only see local maxima, you can't see global maxima. Okay, means there is less stability. For example, government policies are changing quickly, governments are changing quickly, or there are many events happening which you can't predict. Maybe the weather is very uncertain. Okay. Many things were uncertain, many unexpected things were happening. You start taking very short-term decisions, not long-term. So you are sacrificing your long-term benefits or well-being for your short-term decisions, okay, or short-term benefits. Okay, so you might say, okay, like if you want to travel somewhere, okay, you might say, I don't know if at that place, okay, whatever hotel I have booked will be available for me or not. So you will not book the hotel, you will go there and you will book it there. But then you might realize a lot of time you have wasted in finding the right hotel and all these things. But if there is more certainty, you will book the hotel in advance, so you are relaxed. Your hotel is definitely there. So you trust the system. But if there is huge uncertainty, you will start losing your trust in the system. So it will affect you. Classical example again, a greedy algorithm. So traveling salesman problem here. So you are on one city, you want to travel 5 cities from here. Okay. But if there is huge uncertainty, maybe you don't know what are the proper routes in advance, you don't know what might be the weather. Okay. Sometimes road might get closed quickly. okay, or unexpectedly. So what you will do is, in that scenario, uncertainty is there. So you will say, okay, let me go to the next city, which is the nearest one. And then I will decide which next city I will go. Then further you will decide. Okay. So you will travel like this or something like that. But if there is certainty, you will go to Google Map. Okay. You will see all heat maps, everything, and plan various routes. And among them, you will select the most optimum route. You can easily see there is a big difference between the most optimum route and the route you take when there is huge uncertainty. Okay. So what is that difference? You will travel more, you will take more time if there is more uncertainty. Okay. So if there is a competitor who is taking this route and you are taking this route, definitely your competitor will win. Okay. So in business scenario, that will be favorable to those who are having more certainty. So for a country, country will grow faster than others. Or if both are competing, then this country where there is huge uncertainty will remain or backward or going back. Okay. While which is having more certainty is taking all the contracts, all the resources. Even they are able to attract more and more investment, while the country where there is huge uncertainty will not attract more investment. Okay. So you can see that way a developed country might remain developed or even developing further, while undeveloped country might remain undeveloped and developing countries might remain developing. Okay. Sometimes they might reach to the more and more certainty, so they might become developed. But definitely for undeveloped countries, that's a problem. Thankfully, internet is helping us to gain more certainty. Okay. And also AI. So we can take decisions even in uncertainty with a good probability of success. Okay. I can give you an example again for that. Okay. So there is a treasure. There are two guards, famous classical algorithm. Okay. So there are two guards. There is a treasure. One always tells a lie and another always speaks truth. But you don't know which speaks truth and which tells lie. Okay. And you want to know the root of the treasure. Okay. Left. And you can only ask one question. So here you will ask question, one of them, okay, without knowing what is the or who is telling lie or who is telling truth. This is called zero knowledge proof. Okay, zero knowledge proof algorithm. Okay, so again, so the question will include both of these guards. So the question will be, if I ask the another guard, what will be his answer about the direction of the treasure? Now, in any case, the answer, whatever answer you get, you will go to the reverse direction, because again, digital algorithm, okay, one is telling lie and another is telling truth. Multiply that will be a lie. So you can find whatever answer you get is a lie. So you will go for reverse of that. Okay. So you can easily understand, okay, that affects our life quite a lot. And based on that, we developed biases. Okay. So some biases like optimism bias. Okay. Means perception is saying, okay, be positive, while the reality is little bit less positive. Okay. So you are more positive, more optimistic than the reality. For example, during COVID-19, some people started thinking that they are prone of every disease, while others might get killed by of this virus, but we are prone. Virus cannot affect us. It might not be the reality. Everyone is the same. While there is another bias, some people started thinking that this is like they won't survive, so they can say the last goodbye to their family and started going without realizing what is the fact. Okay. So there are large many biases. Okay. Confirmation bias, anchoring bias. So there is a very good movie on confirmation bias. Okay. Recently, okay. Anchoring bias, Okay, bandwagon bias, halo effect. There are large number. Okay, I'm not reading even these. Okay. So these are affecting our decisions. Okay, and marketing companies are taking advantage of these to sell their products. Okay, so you can see how many biases are there, and this is not an exhaustive list. There might be many more. Okay, so these biases are saying we are more prone to take decision through our perception than the reality. Okay, because these biases are representing our perceptions. Okay, so there are biases in our healthcare system, but also our healthcare system is also quite complex. Okay? So there are two types of healthcare systems. Some countries have public healthcare systems, some private, and some mixture of both. Okay, so like the UK, Canada, Malta, they are having mainly public healthcare system where the cost of healthcare is borne by taxpayers' money. Okay. While in private healthcare, you give cost out of pocket. Okay. Even in public healthcare, you give that cost by in terms of tax. So you are paying even if you are not requiring that health services. While in private, whenever you require, you pay for that. Okay. To deal with this system in many countries where there is a private healthcare system, there is also insurance. So you are paying even if you don't need healthcare instantly. Okay. So in private healthcare, some patients want cheap healthcare while some luxurious one. Okay. So health providers want maximum profit. Maximum profit means either you have more hospital visits or keep patients longer. Okay. So maximum hospital visits means maximum readmissions or maximum hospital duration of stay. So sometimes they will keep you to the in the hospital even if you don't require. Many cases you might have seen, and sometimes they will discharge you early or before getting cured completely. So you require to go hospital again and again. Okay. Now you might say that's a very bad practice. Yes, indeed. But think about another scenario. Like in a locality, there is no hospital. Now someone is starting a hospital. The cost of that hospital might be 1 million euro, and they appoint some medical professionals. Okay. So specialist. Okay. So for example, just one surgeon, and they are paying 100,000 euro or per annum. Okay. Now the that surgeon is charging 1,000 euro or 100 euro. Okay. Um, per patient for every surgery. Okay. For 100 euro. So to meet his salary, he needs to have at least 1,000 patients every year or 1,000 surgeries every year. But there are many other costs like 1 million euro cost of establishing that hospital. Say there might be some other instrument running cost and many costs. So to meet these all costs, he might need at least 2,000 surgeries every year. What if there are not these many patients? Then the hospital cannot sustain keeping that surgeon. Okay. So they will fire that surgeon. All right. What will happen with the people who actually need that surgery? There will not be any surgeon. So they need to sacrifice their life. So in both scenario, if you want to keep that surgeon, surgeon might go for some unethical practices or I don't know. But if you are completely ethical, this is a question. So how to solve this problem? Well, you well predict number of surgeries you might need. Okay, every year. Okay, so you might expect how many surgeries? Maybe 200 surgeries every year. All right. So instead of keeping the surgeon full time at the hospital, what you can do is surgeon is coming there once in a week. Okay, or maybe once in 2 weeks. Okay, or on call basis. So whenever needed, that surgeon might come. Otherwise, he or she is working on other hospitals. Okay, so that way you can meet the cost. Okay? So even in that case, you have to tell or you have to well predict number of surgeries you might expect, when you might expect. All these predictions are needed. Okay. Another healthcare system is called public healthcare system. Okay, as I told you, like in Malta, where we ensure everyone gets the same healthcare. While in the private, how much you can pay, you will get that much luxurious healthcare. Okay. Now, health providers want minimum cost because this is funded by taxpayer money. Okay, and many countries are struggling to fund their healthcare system, public healthcare systems. Okay, so like the UK, okay, day before yesterday, NHS declared this year their budget is 5 billion GBP overrun, means whatever allocated, they exceeded 5 billion. Okay, GBP, so it might be almost 6.5 US dollars. Okay, 6.5 billion US dollars extra. Okay, or I don't know, 40,000 crores Indian rupees extra. Okay, so in public healthcare, we try to keep limited resources, whatever needed, and least duration in hospital and minimum admissions. Okay, because of that, there will be a waiting list. Okay, and because least duration in hospital, you will discharge patient early before getting fully recovered. Patient might need readmission. Okay, so further longer waiting list. Okay, so many countries are struggling to meet their waiting list target. For example, for cardiovascular diseases, okay, 3 hours waiting time like heart attack or stroke. Okay, or for other emergency services, 9 hours waiting time. And similarly for elective surgeries, yeah, 6 weeks waiting time, or okay, for others 6 months. Okay, but they are struggling to meet these waiting times. Okay. So because of that, many patients might die while waiting to be seen by the doctor. So there will be poor health care, public outcry. In the UK, government was changed twice because of that problem. Okay. Even to reduce the burden on healthcare services, like in the UK again. Okay, they are coming with, okay, reducing the number of immigrants accessing that service. Okay, so they are working on Rwanda plan, in news. So sending people to Rwanda who are waiting for their immigration application to be decided. Okay. Also, they might see the patient based on the seriousness or severity of his condition or her condition. Okay, or maybe some other systems like, okay, in the UK you might have a special type of insurance which will give you quick access to the waiting list. So like in temples in India, there might be two queues, so the same is there. One is paid and another is free, so the same is there. Okay, so again, it is against the idea of public healthcare system because everyone will not get the same healthcare. Okay, or some might try some other unethical practices to be seen by the doctor quickly. So there will be corruption. Okay, you might easily say, okay, so to deal with this, they might add more resources. Well, the expenditure in healthcare in many countries is quite high. So if they increase further, okay, it might not be sustainable based on their GDP. Okay, but assume they are adding more resources, there will be more cost, short waiting list because there are more resources, longer hospital stay to minimize readmissions. Okay, so minimum readmissions and more patients will be seen. But at the same time, it might be sometimes counterproductive because a waiting list is helping to distract patients who actually, or people who actually do not need medical attention, but just because there is no waiting list or there is access to the healthcare services, they are going there. Okay, so like for example, in the UK, there are various ailment can be seen by the pharmacist, and you need not to go to the hospital for them, like cough, cold. Okay, so that can be done. Okay, but if there is less waiting list, people will not go to the pharmacies and will directly go to the hospital and taking expensive time of doctors anyway. Okay. This might come with many other issues. Okay, one is called medical error. If there are more patients, more medical error. Okay, and unfortunately, a good proportion of avoidable or preventable casualties in hospitals are due to medical errors. This might also increase hospital acquired infection. Like at the beginning, COVID-19 was also hospital acquired infection. Even in Malta, the first cases were seen in the hospital, and that spread quickly. Okay. So, and sometimes even other problems like drug resistance might happen. There is one more phenomena called care holidays, which might be sometimes fatal. So, like there is a carer for a person who continuously need care. Now, that carer needs some holidays, so they will try to send that person to the hospital. But because that person is not having any medical issues, they will artificially develop medical issues and will send them. If there is a waiting list, they might not do that, because even if that artificially created element is there, patient need to wait. So that will not work. But if there is no waiting list, this phenomena might come, and that might be sometimes fatal. It has been fatal sometimes. There are well documented cases. So this might be a problem. Okay. Another problem is discharge delay. Okay. So doctors will be less pressured to discharge patients quickly. So there might be discharge delay if patient is staying longer. Again, there are more probability of hospital acquired infection, medical errors. Okay, so there will be more cost misuse. Okay, and it will start building some waiting list. Okay. So to deal with this situation, you need optimum resources, optimum waiting time, optimum hospital stay, minimum readmissions, optimum patient number, optimum utilization of resources, okay, minimum misuse, and optimum cost, and some waiting list. Okay. So to deal with all these, you need a proper planning. Okay. If the population dynamics is changing, you have to continuously add resources to deal with these changes, or to deal with the increasing demand of healthcare resources. And for that, you need resource requirement forecasting. So there are two main ways to do that. One is admission rate estimation, how many patients you might expect at a particular day, particular time, and length of stay. So how long a patient will stay in the hospital, so that you can understand how many beds will be available and how many extra beds are needed. Okay. Now, there is another way to deal with all these. Okay, so far we are going to hospital whenever there is a medical issue. Okay. What if we are able to predict these medical issues well in advance and even prevent them before happening? So we might easily reduce the number of beds required in the hospitals, or resources required in the hospital. So reducing the healthcare cost in the hospital. But might increase healthcare cost at home. So it might help in ensuring bed availability, in estimating waiting time, having healthcare professionals available, analyzing climate change impact on public health, minimizing the disease risk, assisting correct diagnosis, taking care of your health yourself. Okay. So that is called pupil-centered care. Better capacity planning might also help in having discharge planning, in optimizing resource utilization and management, in understanding whether impact on disease spread, prepare healthcare system for any outbreaks, making public policies, and even analyzing these policies impact, okay, and alerting public in case of any predicted outbreak. Okay, so what is digital twin? How does it work? Digital twin came from first from manufacturing, where you are creating a digital copy of whatever uh, article you are planning to manufacture. Okay, and then see how it will behave, okay, once it is manufactured, so that you can manufacture the right article. Beforehand you can change that digital copy of that article without even actually manufacturing. Many times even you might decide what type of manufacturing system you might need, assembly line and everything, okay, simulating that various scenarios and selecting the best one. So the same thing we can do in healthcare. So we will collect all the data about person, and then based on that data, we will do predictive and prescriptive analysis and simulations and selecting the best intervention. So what is predictive analysis? Predicting healthcare episode or health issues in the future, or health status. If you might remain healthy forever, or you might need some health care. Okay, so health status, disease risk response, and response based on the information already. Predicting the positive and negative impact of various factors, including genetic makeup, genomic profile, present health status, or called phenotype. Okay, so it might also include metabolome or proteome. Okay. Environmental factors like weather, pollution, geography, diet, medicine, sleep, stress, lifestyle, activities, exercise and therapy, relationships. Relationships are quite important because your during COVID-19 you might have seen the risk of getting disease is depending on relationship. Also, there is another pandemic which is called mental health. Okay. So relationship also decides your mental health. Okay. So social and economical status also decides your healthcare. Okay. So, for example, in which society you are living will decide the disease prevalence in that society and how you might get affected. Similarly, economical status will decide what you are eating, what activities you are doing, everything. Okay, so might decide your health episodes in the future or health status in the future. Okay. So you have all this information, you predict. So what? What will you do that with that prediction? You will prescribe to ensure positive healthcare outcomes. Okay, so if there is a risk of a disease, you might take that disease risk or prevent that disease. Okay, similarly, so how you will do it? You will do that by controlling environmental factors like weather, pollution, or geography. So you might prescribe the patient or the person. You might have these the high risk of this. So better to move from here, go somewhere else. Okay, or you might start using air conditioner or stop using air conditioner, or this is too polluted for you, so you might use air freshener. So I don't know, something geography. So if you are living at first floor, you might start living at ground floor or maybe third floor, depending on what is the prediction. Okay, and based on that it will prescribe change in diets, medicines, change in sleep, stress, lifestyle changes. So you might change job, okay? Exercise, therapy, medical tests, intervention. Okay, so all type of interventions it might prescribe, treatment, surgery, gene editing. If there is no prescription in advance, can prescribe then precautions as well as continuous monitoring the progress of that disease risk. Okay, so that when it happens, they can do the intervention. Okay. So in digital twin, you will have predictive analytics, prescriptive, as well as you will simulate various interventions and will see the best intervention for you, or the intervention which is giving the best outcome based on your own situation. Okay. So in digital twin, you will have general information about the person, height, weight, shape, BMI, then genomic profile, phenotype, medical history, family history, health related as well. Okay. Diet, activity, travel history, predictive and prescriptive analysis. Okay. So everything will be there and you will keep it in a system which can continuously analyze that. Yes. Yes. Sorry, there is a question or something? Sorry, there is something wrong. Okay. You will continuously analyze this. So you will also keep laboratory tests, imaging tests, your biomedical analysis tests, behavioral data, and social data in your digital twin. Okay, then you will apply some algorithms or continuously analyze that. You might also collect some more data. So once you have your digital twin ready, it can help you better diagnosis, less automated treatment, okay, fewer side effects, less errors, okay, reducing medical errors. Okay, it might also help you in cost reduction by faster medicine discovery, shorter treatment period, faster clinical trials, better logistics and maintenance. Hello, there is anything wrong? Sorry, should I continue? Okay. Then it might also provide patient autonomy, or we call it pupil-centered care. So the person have more power over even you can keep the person while deciding the treatment. So patient can give his or her preferences, and based on that you can decide the best treatment. Okay, and patient will own his or her own data, and that can be monitorized as well. Okay, you might also ensure fair and equal treatment of patients and less animal suffering. Okay, so you can collect all type of data as we have already discussed. Okay, you might also consider societal disruption. Okay, inequality and injustice, you can avoid that, and you can also consider other risks. Okay, that way you can ensure the best optimum healthcare intervention for the patient, or keeping the patient free from diseases or high healthy life expectancy. Okay, so there are many more benefits. Okay, you can also predict number of patients you might expect to the hospital well ahead. Okay, so it can say, okay, this person might need medical attention after 1 year, 2 year, I don't know. Or even patient will not come to the hospital when there is an issue. Hospital will call the patient, like you might have this, so you can do this. Okay, to avoid all, so prescribe the patient, okay, well ahead. Okay, it might also give patient education, so patient can know why particular therapy is being followed, why many things are being done. Okay, all interventions he can understand and take well-informed decision. Okay, so I can give you one example. Okay, we have actually developed an app. So for example, if you are having a chest pain, okay, based on your own condition, it depends that chest pain might be due to weather, gastric, okay, or it might be having a risk of heart attack. Okay, so based on your condition, it might tell you, then it might tell you what should you do. Okay, again, taking your GP in loop, it might suggest you to go call your GP, or go to the nearest hospital, or go to the specialized hospital for that, or call an ambulance or air ambulance, go to another city. Whatever will be the best option for you, it can suggest you. Okay? So it can also help you to promptly recognizing infectious disease, recognizing factors responsible for non-communicable diseases. Okay, developing better public health measures, policies, analyzing impact of public health measures, and health fraud detection and prevention. Okay. Just wonder if I have 5 more minutes. Okay. I hope I have, because I think 12-13 minutes are there. Okay. So as part of this project, we worked on, we have a sub project which is called Satellite for Health. Okay. So where we are analyzing satellite data, okay, to understand the public health resource requirements and, okay, disease outbreaks. Okay. So this is 150,000 euro project. We recently completed that. Okay. Funded by the Space Research Fund 2021. Okay. Malta Council of Science and Technology, Malta, funded it in collaboration with the European Space Agency. Okay, so this is part of a bigger project which is called the Digital Twin of Earth. Hello, are you able to hear me? Because I'm not getting any.
Yes, sir. Yes.
Okay, so let me continue. Okay, thank you. So the aim of Digital Twin of Earth is to implement Earth observation into the creation of a digital twin of Earth, a dynamic digital replica of our planet, which accurately mimics Earth's behavior. Okay, so there are various objectives. Okay, so these objectives are explained here. The video created by my students. Our Mother Earth, the only planet in. Are you able to hear the voice?
Yes, sir.
Okay, good. The solar system accommodates many species, including us. Complex life on Mother Earth requires stable conditions to flourish. But due to the access human interface on Earth geology and ecology, many global problems are introduced, like global warming, rising sea level, forest erosion, and many more. As a result, life on Earth experiencing instability. Health Organization discovered that 3 million deaths a year are caused by air pollution and is recognized as a contributing factor in the onset of heart disease and cancer. Along with the air pollutants, we must consider other environmental factors like temperature, humidity. Air temperature affects air movement, and thus the movement of air pollution. Because energy from the sun is absorbed by the Earth's surface, air near the ground is warmer than air that is further up in the troposphere. The warmer, lighter air at the surface rises, and the cooler, heavier air in the upper troposphere sinks. This is known as convection, and it moves pollutants from the ground to higher altitudes. In the case of humidity, it is a combination of dry air and water vapor. The degree of combination of this duo ultimately determines how hot or cold the temperature is. This scenario comes alive when we feel intense body heat and skin irritation or shivering uncontrollably. High humidity increases the rate of harmful or toxic chemicals in the air. It also causes dust mites in our homes, dampening air quality. Bacterial and viral organisms that cause respiratory infections thrive due to high and low humidity. Low humidity also causes airborne illnesses. This entire scenario leads to critical situations which are not only harmful to humans but also to other species. We need to find a solution that stabilizes the conditions and leads us towards a better world that everyone deserves. The Digital Twin of Earth project is among the promising technologies that will provide the solution to save our Mother Earth. Suppose we succeed in implementing fusion of Digital Twin of Earth and Digital Twin technology in healthcare. In that case, it will highlight the effect of the Earth's changing environment on particular human replicas. We can digitally create an Earth-like climate to examine its internal and external impact on the human body with the existing health conditions. GIS can be used to explore collating open data to develop a digital twin of city air quality to inform public understanding of health issues, find ways to improve air quality, and move towards a healthy breathing city. We will be showcasing the impact of rapidly integrating multiple open data sources into an interactive digital twin using our cloud-based real-time simulation platform. In other words, healthcare scientists can tackle what-if scenarios without affecting the safety of individuals. The information that this project will generate, not to mention the insights that it will reveal, could drastically improve society's understanding of the challenges and risks of air pollution.
More importantly, we will present multiple ways for reducing air pollution and allow cities to understand the importance of green energy, sustainable transport, e-waste management, e-mobility, and vegetation management. Moreover, every government needs to assess the air quality targets which are allocated to cities on annual basis. Our little initiatives will make a huge difference for our future generations. We urge you, let's work together to make our Mother Earth livable and beautiful. After all, it's incredible in the universe.
So it has 5 domains. Okay, so aerospace, healthcare, wind farm, automobile, and manufacturing. Okay, so we are in healthcare domain. Okay, and this project is described here.
Have you ever experienced a changing weather effect on your health? The answer is not that simple. Changing weather can have long-term adverse effects on the human body. We proposed a satellite for health project to identify primary climatic factors influencing public health. Characterizing the impact of weather factors on hospital admissions and patient length of stay. Modeling correlation between the satellite imagery and weather station data. Develop a public prototype of satellite-based health monitoring and resource requirement forecasting tools. ERA5 reanalysis data is used to collect meteorological data. At the same time, health data was collected from DHIR, and a novel holistic approach was developed to process the datasets and forecasting. We expect a novel tool that can predict the hospital admission rate and patient length of stay by considering weather factors. This project not only discloses the crucial effects of weather on health, but also helps us to improve our health facilities.
Okay, so this is the project. Okay, so we are using because these are objectives that we have already discussed, and we are using satellite data. Okay, so mainly Sentinel, and then Terra Aqua and UMatSat. Okay. We got data from FreeMat and also Environment and Resource Authority. Okay. And then hospital data is from our only hospital in this island. That is the beauty of this island. Okay, so Materde Hospital, which is also having satellite hospitals available at various places. So this is a centralized data center where we can collect data of all and every patient. So we are having information about each and every health episode of any person in this island nation. Okay, so we are using more than 10 years data. Okay, so the organization is part of Ministry of Health, okay, and called Directorate for Health Information and Research, DHIR. This is the model methodology we are using. Okay, so it includes image analysis, data modeling and classification, prognostication and regression. These are programming languages we are using to develop our tools. So Python, MATLAB, R, C, C++, and some other packages. Okay. So some initial results. So we can see maximum variability affects number of admissions the most. Okay. And when the maximum variability means the difference between the temperature yesterday and today. Okay. Average temperature. So when the maximum variability is more than 1 degree to 2 degrees centigrade, then maximum temperature also affects. Okay. Similarly, length of stay is decided by maximum temperature on that day. Okay. And when the maximum temperature is greater than 21 degrees centigrade, then average temperature also affects. And when average temperature is between 21 to 30 degrees centigrade, minimum temperature also plays a role. Okay. Then we have an exact value to predict for depending on these temperature values. Okay. So that is about satellite for health. Okay. Now, for collecting data, actually we developed it at the time of COVID-19. Okay. So that's anonymity preserving, which is important to keep the privacy of the every person. Okay. So we developed an RFID based model, which is very cost effective because RFIDs can be printed and can trace anyone. All so the bigger cost is for RFID readers, not the RFID tags. But yes, we need limited number of RFID readers placed at crowded points so that it can trace human movement. Okay, so that can help in understanding the movements. Okay. So that's also funded by the Malta RIDT and Alfes Sal University, Riyadh, Saudi Arabia. Okay. So it can not only trace human movement. You might have used mobile apps during the COVID-19, but this is not using any mobile app, but just RFID. So you can see any moving object, vehicle, animals, humans, okay, which can affect your health. Okay. And it uses blockchain's trust-oriented decentralization for on-chip data logging and retrieval. Okay, so why this? Okay, during COVID-19, you can even trace the patients like other tracing contact tracing applications, but it can also find out okay better human connectivity, okay, and develop public policies to control the spread of infectious diseases and finding super spreader hotspots, responsible behavior. Okay, so this is so by that we can develop disease network. Okay. Disease network means how various diseases are spreading, okay, so that we can understand, we can design to deal with the spread of diseases. We can monitor the changes in that. We can track, okay, even share with other health organizations or other countries, okay, so that in advance we can be prepared. Okay, we can analyze the impact of various policies. We can learn from that so that we can predict and prepare our systems for future. Okay. And also for each person, we can create medical history, travel history, activities and behavior and family history, which will be part. So patient life log will be part of digital twin we are proposing. So this is the paper we developed. Okay, so now I'm here for any questions. So thank you very much indeed for your attention. I hope you enjoyed the presentation.
Yes, sir. Any queries? Okay, sir. Now it's time for vote of thanks. Dear Dr. Lalit Garg, Associate Professor, University of Malta, on behalf of the entire CSEAi 2023 Conference Organizing Committee and attendees, we extend our sincere gratitude for your exceptional keynote address. Your insightful presentation not only captivated the audience, but also added immense value to our conference. Your expertise and thought leadership in health intelligence through satellite data analytics and digital twins provided invaluable insights that sparked meaningful discussions and furthered our understanding of the advancements in artificial intelligence and computer science. Your commitment to excellence and the quality of your delivery truly set a high standard for the entire conference. We appreciate the time and effort you invested in preparing and delivering such a thought-provoking presentation. Your contribution has undoubtedly left a lasting impact on our conference attendees, inspiring new ideas and fostering a sense of enthusiasm within the CSEAi community. Once again, thank you for being an integral part of CSEAi 2023. We hope to have the privilege of welcoming you back in the future.
Thank you, Professor Sambana. Thank you very much indeed for having me here. And for everyone, I can see 35 attendees are there, which is quite rare in conferences which are being organized virtually. So quite good number of attendees. I invite everyone, whoever is interested in these projects, to collaborate. You can always contact me through email or LinkedIn or some other means. You are most welcome if you are any idea for collaboration. And all the very best to everyone, to your future career, research, and all other future endeavors. Thank you.
Thank you, sir. Thank you very much. Now we are signing off. Thank you for all the participants. Have a great time.